Hi, everybody. I'm Congresswoman Lauren Underwood. I'm the co-founder and co-chair of the Black Maternal Health Caucus, and I am delighted to welcome you to the Black Maternal Health Caucus 2023 Stakeholder Summit. It is a joy to be here with you today, and I'd like to begin by thanking all of you for coming. I'd also like to thank the March of Dimes for hosting a welcome reception this morning. What a perfect way to start our day. I would be remiss if I didn't begin by shouting out my sister and my friend, the co-chair of the caucus, Congresswoman Alma Adams. Unfortunately, Representative Adams is unable to attend in person today, but I couldn't ask for a better partner in this work. I want to thank all members of the Black Maternal Health Caucus who committed themselves to elevating the maternal health crisis and taking action to end it. And finally, I'd like to thank the distinguished members of the Biden-Harris administration who are with us today. There has never been an administration more committed to maternal health, and I appreciate the ongoing leadership of Vice President Harris, President Biden, and others throughout the executive branch who you'll hear from later today. As we prepare for a full day of conversations, planning sessions, and opportunities to connect and celebrate with each other, I can't help but reflect on the journey that we've been on together. Think about where we were the last time we gathered for a Black Maternal Health Caucus Stakeholder Summit. Standing room only in a small meeting room in the basement of the Capitol. Look at us now. 4 years later, we're gathered in the United States Capitol Auditorium with the support of the President and Vice President of the United States of America, leaders of the Department of Health and Human Services, congressional champions, and hundreds of organizations and companies from across the country. And we've done more than raise awareness. We've delivered results for moms and families. We passed legislation, secured funding, and enacted policy changes that are expanding access to high-quality maternal health care and robust support throughout the perinatal period. But we still have so much work to do. Last month, a study published in JAMA underscored that even with the increased attention to this issue and the actions we've taken, the maternal health crisis is getting worse. The number of maternal deaths more than doubled over the past 2 decades, and the maternal mortality rate increased by more than 150%. And within these alarming numbers, there are glaring racial and ethnic disparities in rates of mortality and morbidity. The data paint a clear picture. The United States is experiencing a maternal health crisis. It is devastating, it is tragic, and it's getting worse. But that's not the only story that we can tell. There's another story too, a story that brings each of us together, a story of hope. Right now, all across the country, there are people showing us that we can end this crisis. We know what to do. We know that solutions exist. We just need policymakers to invest in them and in the people and the organizations who are doing this urgent work. The legislation that would do this is called the Momnibus, and Congress must pass it right now. I was so proud to first introduce the Momnibus in 2020 with then Senator, now Vice President Kamala Harris. Since then, working with Senator Cory Booker, Congresswoman Adams, and now more than 200 co-sponsors between the House and the Senate, we've reintroduced the Momnibus as a package of 13 bills to comprehensively address every driver of maternal mortality, morbidity, and disparities. The Momnibus addresses clinical issues like maternal mental health conditions and shortages of maternity care providers. It also addresses non-clinical issues, the social determinants of health that affect outcomes like housing, transportation, nutrition, and environmental conditions. Most importantly, the Momnibus makes investments directly and specifically in community-based organizations, providing historic levels of funding that would allow organizations like yours to continue to do the life-saving work and spread the models you've developed to every community across the United States. Last Congress, we had the first bill from the Momnibus enacted, the Protecting Moms Who Served Act, which invests in world-class maternity care for veterans. I was so excited to go to the White House and see President Biden sign it into law, a moment that reflected years of hard work and advocacy from so many of you in this room. But we knew then that the Protecting Moms Who Served Act was only the beginning. Without passing the entire Momnibus, we won't be able to make the comprehensive investments that we know are needed to address our nation's growing maternal health crisis. So we're going to do a lot of celebrating today, but my friends, today is a work day. Looking out at everyone gathered here, I've never been more confident that we can do the work that's needed to save our moms, end these disparities, and provide every growing family with the care and support that they need and deserve. Leading that fight is our distinguished co-chair and co-founder of the Black Maternal Health Caucus, Representative Alma Adams. Representative Adams is serving in her 5th term, representing the 12th Congressional District of North Carolina. In addition to co-chairing the Black Maternal Health Caucus, Representative Adams is the founder and co-chair of the Congressional Bipartisan Historically Black Colleges and Universities Caucus. Through her work leading the HBCU caucus, Representative Adams enacted legislation to provide historic funding for HBCUs and other minority-serving institutions, known as the Future Act. That accomplishment is one of many that Representative Adams has made during her time in Congress, and I am so proud of all that we've achieved together through the Black Maternal Health Caucus. As I shared, she couldn't be with us today, but Representative Adams and I sat down a few days ago to discuss her leadership to address the maternal health crisis in the United States, her vision to establish the caucus, and the path forward to getting this package to the president's desk. Her energy and her passion for this work has never wavered, and I left our conversation energized and uplifted.